So have you ever noticed that sometimes the problem that people have with walking is they can't shift their weight?
Yes.
Yeah, so you can strengthen your little heart out, but if you're not shifting your weight, you're not going to be able to take a step. I mean, think about it. Your feet are down. If you don't shift, if I just try to lift up my foot without shifting my weight, it's just not going to happen.
Right.
So you really have to shift your weight. And for people who have Parkinson, sometimes people who've had strokes, this is a big problem.
Or even orthopedic surgeries, like if you had a knee replacement or a hip replacement, loading all your weight onto that leg can be challenging. And you have to relearn how to do that, so people don't want to shift their weight onto that leg.
Yep.
So orthopedics and neurological conditions.
Yep, perfect. So Dr. Jennifer Brock in 2017 came up with this really good movement protocol that she uses to help people with gait and balance. Her protocol is extensive. We're talking the appendix was, I don't know, I think it was in the hundreds. The pages, very, very specific on what to do. So we're not going to do all of that, but we're going to show you
a small sample of that.
We're gonna do a little
bit of it.
But I think it's enough that you can work on it, and it might help those of you that kind of feel like your feet are stuck to the ground and you can't lift them up. It'll help you work on your weight shifting. So do you want to show the first?
Yeah, I'll show the first progression. And I practice weight shifting with all my patients, whatever the condition it is. And if there's some gait deficits, I always have them train weight shifting because it's so easy to do at home. So the first one is just an anterior, posterior, front and back weight shift. Start holding onto a counter or chair. You're going to stagger your stance. So one foot in front of the other. And all you do holding on, you can hold on with both hands if you like. I also like sometimes doing this in a doorway so you can put both hands up. You're going to just shift your weight onto one foot and then the other. Rock back and forth. And as you do that, and you're starting to do it, it might be very small. It might just be a little bit of a forward lean and a little bit of a backward lean. So you're just working, transitioning, weight one foot to the other. As you get more confident, you can increase the size of your weight shift. You definitely want to do it both feet in front. So switch your stance, same thing, small to bigger as you feel more confident. And then the progression is just to let go and start moving more freely in the weight shift. And then as that gets easy, add some arm movements, and almost like you're facilitating, like you're walking, you're going to swing your arms back and forth. You can do big arm swings, you can do both in front, both in back, and that just really gets you used to accepting weight onto your front foot and onto your back foot. All right, and do this again on both sides. And then you want to show the other direction to do this?
The other direction is side to side. So you get the chair, and now we're going to go side to side. All right, and so same thing, you're going to shift side to side, all right, holding on, then you're going to shift side to side, no hands, then you're going to shift side to side, and then use arm movements. And then you can really feel the momentum when you bring your arm movements in. But for both of these, Dana saved this for me, you then finally get to where you're doing the activity, but you lift your foot off. Now for that, you might want to hold on, so you're going to shift, okay, and then lift your leg off, shift, lift your leg off, shift, all right, then one arm, okay, then no arms, then using arm movement as you shift your weight onto the leg. So you can do that forward as well.
Right,
okay.
So it would be forward and back, lifting your foot up and down.
Yep.
Yeah.
So I think it's a nice way, easy way, progressive way to work on shifting your weight so you can walk better.
And it directly carries over to gait, so you're going to really notice an improvement in your quality of walking.